Neurotransmitters such as dopamine are extremely significant in the brain's control over the body. Today's presentation will describe the synthesis and degradation of dopamine and these processes' role in pharmacological treatments for Parkinson's disease, as well as the side effects of these treatments through their impact on the dopaminergic pathways.
The building blocks of the dopamine pathway begin with phenylalanine. L-phenylalanine in particular is considered an essential amino acid, meaning it needs to be sourced from the diet. It is found in foods such as eggs, dairy, meat, and soy products. Phenylalanine is converted into the amino acid tyrosine by the enzyme phenylalanine hydroxylase. The hydroxylase enzyme adds an OH group, as seen there. Tyrosine is then converted by the enzyme tyrosine hydroxylase into levodopa, or L-dopa. Tyrosine hydroxylase is the rate-limiting enzyme in the dopamine pathway, meaning it determines the overall amount of dopamine being produced. The final step is where L-dopa is converted by the enzyme dopa decarboxylase to form dopamine. Other important cofactors in this pathway include tetrahydrobiopterin and its regulator, the enzyme GTP cyclohydrolase 1. Modifications of any of these three enzymes using gene therapy could significantly impact on striatal dopamine levels.
Thank you, Lachlan. Like its synthesis, the degradation of dopamine is a vital process within the body. The dopamine released into the synaptic cleft is absorbed by the surrounding glial cells, and the metabolism or degradation of dopamine is catalyzed primarily due to the enzymes monoamine oxidase or MAO, aldehyde dehydrogenase AH, and catechol or methyltransferase, also referred to as COMT. The order that these enzymes interact with dopamine does differ. However, these degradative processes will always result in the formation of the metabolite homovanillic acid as its final compound, which is excreted through the urine. In the case of MAO and AH being the first to interact with dopamine, 3,4-dihydroxyphenylacetic acid or DOPAC is formed, and the further addition of COMT gives the resultant compound homovanillic acid. Similarly, if COMT is the first enzyme to interact with dopamine, as on the right of this flowchart, it results in the formation of 3-methoxytyramine, and the following addition of MAO and AH again results in homovanillic acid as its final compound.
Thank you, Nicole. Now let's take a look at how the synthesis and degradation of dopamine can relate to pharmacological treatments of Parkinson's disease. Parkinson's disease is a neurodegenerative disease of the nervous system, which involves the dopaminergic degeneration neurons in the substantia nigra compacta, therefore leading to dopamine being sourced externally through the use of pharmacological treatments such as L-dopa, dopamine receptor agonist, and monoamine oxidase inhibitor. There is currently no cure for Parkinson's disease. However, there is numerous pharmacological treatments that can help improve motor functions. So let's get into it. Pharmacological treatment of Parkinson's disease employs several different approaches, yet the most common forms of treatment is the administration of L-dopa and dopamine receptor agonists, which I will discuss later. L-dopa treatments aim to increase the amount of dopamine synthesized. As dopamine is unable to cross the blood-brain barrier due to the molecule being too large, L-dopa is the precursor molecule for dopamine and has this ability to cross the blood-brain barrier. This is done through a large neutral amino acid transporter, LAT1. LAT1 is found on endothelial cells and converts L-dopa to dopamine via the enzyme dopa decarboxylase to restore dopamine levels in the brain. In conjunction to L-dopa, carbidopa is administered, which is a dopa decarboxylase inhibitor that is impermeable to the blood-brain barrier. Carbidopa is used to prevent the conversion of L-dopa to dopamine in the periphery only and allows more L-dopa to cross the blood-brain barrier. This is achieved through the deactivation of dopa decarboxylase enzyme in order to prevent the conversion of L-dopa to dopamine prior to crossing the blood-brain barrier. This is pretty interesting, but there is some side effects, and I will let Sophia discuss these with you.
Thank you for that informative overview, Hannah. Now it's time to talk about the side effects of L-dopa. L-DOPA is not a perfect treatment, so naturally side effects will be seen. These include nausea, vomiting, low blood pressure, restlessness, and confusion. A tolerance to L-DOPA can develop, which means high doses must be administered in order for it to be effective. These high doses may cause ballism and psychosis due to excessive dopaminergic activity. A visual of this can be seen on screen. Furthermore, after 2 years on L-DOPA treatment, an on-off effect appears. This means that the time that the treatment is effective decreases as the amount of L-DOPA administered increases. Additionally, after 5 to 7 years following treatment initiation, significantly more motor dysfunction is seen. This includes dyskinesia and dystonias. Considering all these side effects, L-DOPA has a maximum benefit of 10 years. Therefore, it's vital that L-DOPA isn't administered straight away and alternatives are found. I'll now be handing back to Hannah.
Thank you, Sophia. Now let's take a look at dopamine receptor agonists. This pharmacological treatment mimics the neurotransmitter dopamine in the brain and can be used as an alternative to L-DOPA or in association with L-DOPA. Dopamine receptor agonists stimulate the synthesis of dopamine through the binding of dopaminergic receptors. Thus, they do not need to be converted to dopamine. Rather, it mimics dopamine. Dopamine receptor agonists are often prescribed to younger patients as an initial therapy prior to the therapeutic intervention of L-DOPA. Yet there are some side effects to this, and I will let Sophia discuss this with you.
Thanks so much for that, Hannah. As mentioned previously, an alternative to L-DOPA are dopamine receptor agonists. Common side effects include hallucinations and paranoia. This is due to the increased activation of D2 receptors that simultaneously activates the mesolimbic pathway, which can again cause psychosis. Dyskinesia, vomiting, and nausea are also common side effects. Addictive behavior may form as well, and this is due to the mesolimbic pathway activation. This is also our reward pathway, which, as I just mentioned, includes D2 receptors. Examples of this behavior include pathological shopping, eating, hoarding, and gambling. When given alone, dopamine receptor agonists are less effective than L-DOPA, so it's commonly given in conjunction. We will now be returning to Hannah to discuss the final treatment.
Thank you, Sophia. Now let's take a look at dopamine metabolizing inhibitors, or more specifically, monoamine oxidase inhibitor. This aims to prevent dopamine from being degraded. MAOB is an enzyme that breaks down dopamine. Through the administration of monoamine oxidase inhibitor in a medication, it aims to block the mediated effects of MAOB, therefore making a more abundant supply of dopamine, and is used in the means of improving motor symptoms associated with Parkinson's disease. However, there are several side effects associated with this, and I will let Sophia run this through with you.
Thank you for that, Hannah. Interestingly, dopamine metabolizing inhibitors can decrease the on-off effect that's seen in L-DOPA. These are generally well tolerated, but gastrointestinal side effects are among the common problem for patients. Other common side effects of the MAOB inhibitors include nausea, dry mouth, lightheadedness, constipation, confusion, and hallucination. Dyskinesias may also occur as a result of the enhanced dopamine levels in the striatum.
Thank you, Sophia. Considering there is no cure for Parkinson's disease, the current treatment options primarily focus on improving motor symptoms associated with the disease. It is important to ensure that the approach for treatment should be based on the patient's prognosis and severity of disease. Due to the potential side effects that come with the treatment options, it is viewed that the benefits associated with the treatment options outweigh the potential side effects. Thank you for listening, and I hope you have enjoyed.